三个演讲者是Dr. Ndaba Mazibuko. He's from 他是从伦敦过来的，他代表了伦敦King's College and Care Oncology Clinic， 所以他们这个组呢，他做了非常多的这个方面的就是老药新用的研究。所谓老药就是已经在市场存在了很多年，但是我们现在呢就重新把它拿出来，市场用在我们的这个结合了生酮饮食和其他的治疗方法，重新焕发了青春这样一种药。那么他具有非常多经验。Dr. Mazibuko 呢，他是一个神经内科医生，他具有非常多的这方面的经验，所以我们认真的听他的一些经验的传述。谢谢。
Good afternoon. Thank you. It's a real privilege and an honor for me to be here with you this afternoon. I'm very excited to meet lots of you and to talk about what you do, but also to share what we do as well. We've heard a lot about the theory of how the metabolic approach works in cancer, and as you can tell, it's really compelling, really convincing theory as to how we can make a real difference in this disease and change things. What I'm going to be talking about this afternoon is how we do that in practice. So what can we do now to implement some of this theory that we've been talking about?
这个马吉布医生呢，我们这次来4位，其中有3位是医生。换句话说，我们有很好的理论，我们临床上关键是要怎么用，怎么来救病人，对不对？那么导致马吉布呢，就是仁登大学国王医院的里面的一个医生。那么他们就在这所谓的综合疗法上面，怎么利用这个代谢疗法，用一些已经有的药，但是就要新用。你要知道，一个药出来的话，有一种指证，对不对？那么其实呢，我们现在发现很多这个药有别的功能。那么这些药在代谢上面进行对癌症阻断。那么他们介绍一些这么经验，他们成绩很不错，所以我很高兴。I'm very glad 把他也请过来向大家介绍一下。
So one of the things that can be done now is to use drugs that are already in existence, so drugs that have been used in other conditions and repurposed into cancer use.
I just translated already.
Okay, good. So for the last few years I've been working in a clinic in London with a group of people to use these drugs in practice. And over the last few years we've treated lots of different types of cancers. I'll be talking a lot about glioblastoma, but actually, as Dr. Siegfried said, this approach is possible to be used in any type of cancer.
他们已经在2014年以来，就是30年，已经治疗了大概有1300多位病人。那么他们的重点尽管是在那个脑瘤，为什么国际上用脑瘤呢？就是脑胶质瘤，因为这是一个没有办法治疗的疾病。所以难听的说叫死马当活马医，这是国际上一个公认的，所以很多新方法在这方面使用，他们在这方面很有经验。那事实上呢，这种方法可以推广到几乎所有的癌症。
So the important thing to understand about this approach is it utilizes lots of different target pathways. So the idea is to target the cancer from lots of different angles. It's almost like you're taking the battle to the cancer on lots of different fronts.
这治癌的话，我们不能定这一个点。这就好比，其实呢，我们治癌和打仗一样，对不对？我们要从多个角度来治疗癌症，从能源供应，从等等，对不对？这就是我们那个 approach。
So drug purposing, as I said before, is to use drugs that are already being utilized in other diseases and moved over into cancer. The importance of this is manifold. So one of the things that we're doing with this is to short circuit or cut down the time for development of these drugs into cancer.
那么就药新用的最伟大的、最好的地方是什么呢？因为这些药已经在市场上很久时间了，很多至少比如说它的这个安全性等等已经被广泛研究，对不对？所以在这样的话就可以在新药发明的时候就可以省很多时间和许多金钱。那么事实上呢，对于投资商来说，这也是因为这可以重新这个叫 patent 可以申请专利的，对吧？所以这是一个国际上一个比较新的一个 尝试。那么这我们呢，在这个癌症治疗上面，他们也有很多经验。
For most drugs which are created in a novel approach, so new drugs, it takes usually about 10 to 12 years for those drugs to go from the idea stage to the market stage.
那么新药开发的话，这个从市场至少要10年开发时间。
And for a lot of these drugs, it will take hundreds of millions, sometimes billions of drugs to produce these drugs from the new stage to the market stage.
平均我也许搞错，平均大概要500个 million， 就是多少？反正说上亿很多钱来开发一个新药。
But for repurposed drugs, you can get these drugs in less than half the time and a fraction of the cost to the market and treating it in the cancer setting.
旧药新用的话，可以把时间减到就是减得很短，然后花很少的钱。
And the reason you can do this is that you already have existing data about the safety and tolerability of these drugs. You know the dosing, you know exactly how they work in terms of the pharmacokinetics.
我刚才已经翻译了，其实这药在移动力学等安全性等已经都研究好了，不需要重复。
And of course, in terms of the patient, but also in terms of society, there are real cost benefits for these drugs as well.
对这种这个尝试的话，对病人以及对社会应该有很好的就是可以时间上和金钱上的节省。
So what we did at the clinic was try to go through the long list of drugs that existed that had evidence in cancer, but were being used in other diseases.
那么他们的关爱诊所里面呢，对很长的一个这个药物，他们进行筛选，看哪些在癌症上面应用有它的特殊性，然后在里面找出一些来这个中心就药行用。
And we narrowed it down to a list of 4 or 5 drugs that we thought met the following criteria. Firstly, we needed drugs that had very good evidence in the normal medical and scientific peer-reviewed journals.
那么这个很短，在这里面找到很短的一些药物，那么这些药物必须要有显示对致癌有好处。
And secondly, we needed to find drugs that had low toxicity, so drugs that were safe and well tolerated, and drugs that didn't have negative drug-to-drug interactions with other drugs.
而且呢，和没有药与药之间的不反应也没有，或者很少。
So that they could be used in a synergistic effect.
那这些呢是我们筛选的这个一些指标。
So the first drug on our protocol is a drug called metformin. This is a drug that's normally used to treat patients with diabetes. And it's a very common drug at the moment. Globally, the type 2 diabetes is on the rise, so this is a drug that is increasingly prescribed for diabetes.
这个二甲双胍是主要是通过抑制糖益生，癌症上面有用了，对吧？我们抑制糖的产生。那么其实呢，二甲双胍对抗衰老现在好像很时髦，大概也听说过了。欧洲已经有对二甲双胍在延长寿命、在抗衰老上面有这个临床试验。
But as you can see, in the cancer setting, it has a number of different effects.
那么在一个癌症治疗上面有几个方面。
So, for example, it targets apoptosis, programmed cell death.
那么这个二甲双胍对糖益生的抑制，对这个瓦多的效应，对这个细胞凋亡等等都有作用。
And it also targets some of the glycolytic pathways as well that Dr. Seifried mentioned.
以及其他的那个糖效这上面的一些辐射。
And so our next drug is a drug called mebendazole.
另外一个药物叫做甲苯达唑 mebendazole.
So this is an anti-parasitic drug, an anti-helminthic drug. So it's often used in treating worm infestation.
这是治疗蚊虫病的。我们小时候我记得好像我们都好像都要吃一点。
But in the cancer setting, it's also involved in a few different areas. So it's involved in angiogenesis, it's involved in apoptosis, and destroying some of the tubulin structures within the cell.
这个甲苯达唑发现在那个细胞凋亡等等方面也有效果，所以这也是他们找出来的一个药物。
Atorvastatin is our next drug. It's the drug that's used in treating cholesterol problems.
这个叫中文叫做这是一个抗甲这个胆固醇的药，那么它在治疗癌症上面也有好处。
But in the cancer setting, it also has a number of different pathways affecting apoptosis, affecting lipid and cholesterol membrane synthesis as well.
对这个刚才你说了嘛，对胆固醇的调节，对这个细胞凋亡的调节都有作用。
And the final drug on our protocol is a drug called doxycycline, which is an antibiotic drug.
第三个是doxycycline，这多西环素，这个翻译错了，我记得。我这个老药我在中国也用的时候，叫做我都忘了，反正不是多西美素，多西环素。我们anyway， 这个也是一个抗菌素。
But in the cancer setting, it's involved in blocking a couple of pathways. It's reduces the cellular respiration, another cancer effective pathways.
它也抑制在糖代谢的环境中也有作用，所以我们也选了它。
So this is just more of a schematic of the same pathways which are being blocked.
那这是一个生化机理，我们就不多说了，就是如何它抑制这个细胞的癌细胞的。
So as you can see, what we attempted to do at the clinic was to target a number of different pathways and do that in a way that had an extra synergy. There are more and more papers coming out to describe how even one of these drugs, like metformin, for example, can be effective. But if you add in a second drug, like atorvastatin, there was a paper that came out looking at prostate cancer to say you had an effect with metformin, but you add in atorvastatin and the effect is even greater. So we were trying to maximize that with using lots of different medications.
这是一个多环节进攻的一个方法。那么这个4个药或者几个药之间的话，不是1加1，经常会产生一个所谓 synergistic 1加1等于超过我的这种效果。
But the important thing about these drugs is because of their low toxicity, even if you're using 3 or 4 or 5 drugs, there is no extra burden to your organs or extra toxicity because they are designed to work with the system.
很重要的一个，我们今天下午讲的是重复出现的问题是吧？低毒性，这是一个非常重要的概念。我们认为，只要对治疗癌症有好处，这毒性低的话，我们都可以试一试。治疗癌再怎么好，毒性很强也没有用啊。其实化疗有用的，问题是什么呢？在把癌细胞杀死的时候，把我们也杀了，对吧？这种药就没有意思，对不对？
So we took this approach and applied it to a range of cancers, as I said. But one of the key cancers that we've been focusing on is glioblastoma. So this is a cancer which is the most aggressive, most deadly cancer, brain cancer on the planet at the moment.
刚才已经说了，这个脑角质细胞瘤这是最头的，几乎没有什么治疗的方法。那么我们就用这个来显示。
And there are, a number of cases diagnosed every single year, more than 2,000 in England. And the key thing about this cancer is that it is extremely, it has an extremely poor prognosis. So the life expectancy is incredibly short.
光英国每年大概就有2200例子，那么平均这个诊断到诊断到死亡的话，只有大概半年到9个月时间。
So someone who has no treatment for this type of cancer will have somewhere between 6 and 9 months on average to live.
6到9个月时间，刚才于医生讲过了，是于医生还是他们有一位病人啊，是他们讲的，已经3年多了，也是在英国的。
And even if you have the very best treatment that the world has to offer, that only pushes it to 14.8 months. So the average person with the best surgery, the best radiotherapy, the best chemotherapy will only live for 14 months.
有钱人或者你得到最好的治疗的话，大概也只能达到15个月，15个月是1年半不到。
And this data is exactly the same throughout Europe, throughout America.
英国而且欧洲和美国的数据差不多，最长也就是大概15个月。
And so this again is just another schematic to show how serious and how dramatic the rates of death are with this treatment. So this is the protocol that we applied to the patients that had this tumor. So again, we had metformin, atorvastatin, mebendazole, and doxycycline. And what you will notice with these doses are that these are exactly the same doses that will be used for patients who are receiving these drugs for their normal conditions. So, for example, if you had diabetes, you would get metformin at exactly the same dose. If you had high cholesterol, you would get the statin at exactly the same dose, the same for mebendazole and doxycycline. So we're not doing anything new in terms of the dose.
这是一个4药联用的一个方案。 我们这注意的话，这里面用药的剂量呢，和它原来的剂量是没区别的，一样的。比如说这个第一个这个二甲双胍500毫克，一天一次，吃的比我还少，我一天吃2次，所以我们在用这些药，并没有在以前已经被批准的范围外。
And so for the last 3 years, we've analyzed data for all of these patients, and we've analyzed data for 95 patients who have had this type of tumor, the glioblastoma. So,
他们已经治疗了95例，已经把结果总结出来了。
And so for the 95 patients that we've seen, the average, if you remember the average for the best care treatment is 14 months. The average at our clinic is now 27.1 months, so almost double the survival time.
那么刚才我们说了，即便是接受到最好治疗的脑胶质瘤病人的话，也只能到14、15个月。那么他们诊所总结了95例的治疗效果的话，可以达到27个月，差不多加倍。那么这里我在他待会会说，我先说了，他们没有发表出，没有在上面写出来，为什么呢？这篇文章已经送稿了，然后这个杂志社的话，在他们发表以前不允许他们发表。
And another way of showing how dramatic the change has been, the 2-year survival for the best care treatment with the normal standard of care treatment is about 28%, 2-year survival. At the clinic, we've had 55.8%.
这些病人2年生存率大概只有22%左右。
So even the 2-year survival is almost double what the standard of care treatment is. So quite dramatic results. So the question for us is, how do we move forward? How do we put this into regular practice? I think all of us here would be interested in getting this treatment out to as many people as quickly as possible. So the first thing is that we need to have a different method or different strategy about thinking about clinical trials. As I
那么下一步就说，首先呢是一个战略这个策略问题，我们这个临床试验怎么个做法
So for the first thing, as I said before, a novel drug, a new drug to go from the idea stage and the lab stage to the market will take you an average of 10 to 12 years to do.
传统的话，从这个开始到最后大概是到12年左右。
And the main reason for that is that the industry or the scientific community is used to doing very large, very lengthy, randomized blinded trials.
那么因为什么呢？因为现成的体制就是要这种这个控制、那个控制等等，造成了这个现象。
But for patients with glioblastoma, if they have an average of 14 months to live, they don't have time to wait for those lengthy trials.
但是对这些有病人的人呢，他等不了那么久。
So we have to find a different strategy, a different way of doing that. So some things are quite clear and obvious from other sources of evidence.
其实有些的话，我们现在这是一个问题，我加一句啊 ，my app。现在我们什么容易提出新的问题来呀？我们这里面也有学医的，对不对？第一个问题，你有没有临床数据？有没有大剂量数据？我一听我就有点，我说青霉素是靠大剂量数据发现的吗？你如果什么都要大剂量数据，那总要小剂量数据开始啊，对不对
We've got evidence from epidemiology, we've got evidence from the lab, a lot of the work that Dr. Seafried and co have been doing, but we're trying to find other ways of doing that. I've been working with a team at King's College to try and get MRI evidence to look within the tumors to find metabolites and metabolic markers that we can use to help us better perfect these treatments.
那么他现在就是我们现在去寻找一些指标、标志啊，什么东西来如何再进一步改善这个方法。
And so it's becoming increasingly important for all of us to try and do trials of a different kind and look at radically different ways to move away from the usual conventional studies in order to deal with this really pressing problem.
那么尽管如此说，我们确实要有效的能够让大家信服的方法来进行临床试验来证明。那么怎么样来做这些事情呢？
And so it's important to realize, I often get asked when I'm at the clinic, why has treatment remained the conventional treatment if there are new methods like this and new approaches like this? And one of the reasons for that
呀，那现在市场上还有各种这个治疗方法、那个治疗，包括这个方法，对不对？可是为什么医院里面没有用呢？
One of the reasons for that is a financial reason, is that actually for a long time there has been strong financial interest to keep drugs being produced in a similar way.
那么很重要的原因，当时是这个朝钱的问题，对不对？因为为什么呢？这个新药产生，他们这个药界的话已经有一套系统，对不对？好坏到就这个系统，他就习惯了用这套系统来产生新药。
And unfortunately, some of those pressures haven't always been the best for the patient.
那当然，这些很遗憾的话是，并不是以病人的利益为主要的，因为药厂嘛，当然是首先是要赚钱。
But what I think is important is for us to think about how we can bring together strategies that collaborate with different disciplines.
那么，所以很重要的就是要把各个这个关键的话都要抓起来，一起来合作。
So we need to find a way to collaborate with other professionals, but with patients as well, collaborate with the pharmaceutical industry, with technology and business and government as well, to come to solutions that are quick and effective.
所以要证明一个新的方法的那个有疗效，我们认为现在要和病人合作，要和其他专业人士合作，也要和药厂合作，和技术合作，和这个商界合作，尤其是政府部门合作。只有通过这样一个多途径的这个合作方法，也许我们可以找到一个更有效的、更快的或者更省钱的证明这个治疗方法的一个途径。
And the important thing is that we need to keep the patient or the individual at the forefront. And if we keep thinking in that way, then we will be able to innovate and find ways to better help the patient more quickly.
这一点非常重要，我们一定要记住，我们任何做事情、做任何事，应该是比病人最低。I want to add something here. 我们这个几十年的癌症研究，对不对？诺贝尔奖获得了多少？一大堆。这个药厂的药卖的钱挣了一大堆。教授们、这个科学家、医生们，这个挣了很多工资，什么也挣了不少钱。可这里面你看，唯一缺失的环境是什么？是病人。我待会有一些数据来证明，我们病人没有得到任何好处。
And I think the thing for us is to somehow move away from just purely thinking about this in an academic sense. To say, okay, we have the evidence, we have the science, how can we move that into a real life setting? So how can we move that today, not in 10 years, not in 20 years, but how can we move that quickly into a way that reflects how society works and the need that exists today?
我们既要有科学家像Dr. Seabury 这样这个做研究，那么同时也要很实在，怎么能够把我们研究的成果能够变成诊所里面让病人活跃的这个东西，这是一个非常重要的一个关系。
So one of the things that we've been doing at the clinic is to have a two-part strategy. So the one-part strategy is to try and develop these drugs and try and get patents and to move behind the scenes, and obviously that takes longer. But the second part of the strategy is the present day one, to say there are patients today who need help, what can we do for them today? And drug repurposing is a great way to move drugs into the clinic today while you are perfecting them for the future.
那么他们诊所里面有两条腿走路，一方面呢按照传统的方法走，另外一方面呢，怎么诊所里面我们等不及，怎么在诊所里面用就可以用。那这里面我也加一个，这个国外和国内呢恐怕有些不一样。国外的话有所谓叫做 off-label use， 换句话说，一个药批准是治疗这个的，作为我医生，我有权把这个药用来治疗别的。国内的话不一定可以这样用，至少从这个大学医院来说，好像是这个问题。当然，这个到底怎么样，我不是太清楚。
I think this is a very exciting time for us. I don't think there's ever been a time in history where we can collaborate so closely with technology, with business, with scientists, with clinicians, all together in a way that can advance things very quickly. I think in the past, people used to operate in silos, the scientists over here, the business people over there, but now we have a real opportunity to bring all of those things together. And if we can do that effectively and efficiently, we can change the world as far as healthcare is concerned.
Okay, excellent. 那么以前传统的药物开发的话，主要是药物公司在做，对不对？现在其实改变了，应该。现在我们在做，我今天就已经碰到了一位投资者。就现在什么应该是病人。首先，我们不反对赚钱，但赚钱一定要是以病人取得实际效果为最基本的目的。 你赚钱要怎么说吧？叫君子爱财，取之有道，对不对？你事情没做好，光赚钱，这个事情很不好的。那么，所以现在一个新的方式，其实这个新的方式应该逐渐在国际上越来越多，就是说，投资家、医生、科学家、政府、病人、药厂合作起来，能够尽快的以最短的时间、最快的办法少的钱，把这些治疗方法带到诊所，这是我们的政治目的。不要永远以这个利益为第一目的，这是一个很重要的目的。
So thank you very much for the opportunity. I'm very much looking forward to collaborating with many of you so that we can change the world together. Thank you.
很高兴感谢。